Good afternoon, everyone, and welcome to the Global Centre on Healthcare and Urbanisation here at Kellogg College. Today is our final seminar of the seminar series for this academic year, and today we're going to be talking about retrofitting and designing healthy built environments. So I'd like to also share and thank the Princess Foundation, who is our partner with our seminar series. So they've been a huge support of this work, and I'll now pass over to Juliet, who's going to chair the session and introduce our speakers. So thank you for all being here today.
Thanks. Yes, and welcome to Kellogg, welcome to the GCHU, and this last public seminar of the academic year. Tonight, each speaker has been asked to respond to the question, retrofitting and designing healthy built environments. How can buildings help our health? Retrofitting and designing healthy built environments is a key issue for two main reasons. Firstly, it lies at the heart of the net zero agenda. 17% of greenhouse gas emissions come from buildings, and of those, 77% come from homes. So there's enormous interest in retrofitting buildings and particularly homes to address climate change. But secondly, and linked to this, homes are key to health, as we show in our report for the Commission on Creating Healthy Cities, which is going to be launched on the 13th of July. Warm homes are healthy homes, but unventilated homes can also bring health hazards. So into this complex issue, how can buildings help our health? So here tonight, to give us some answers, we have 4 speakers coming from a variety of contexts and disciplinary backgrounds. We brought together a range of perspectives to the topic, including humanities and social sciences, to bring a truly interdisciplinary perspective to the discussions. In terms of format, each speaker will have 5 minutes to present their response to the question, one after the other, and then we'll open up to the floor for questions. And at the end, there'll be refreshments at the back to carry on the discussion, so please do stay with us. So welcome to you all, and without further ado, I'd like to move to our first speaker, who is Professor Rajat Gupta from Oxford Brookes University, Professor in Sustainable Architecture and Climate Change.
Thank you, Juliet, and thank you for inviting me to share some of our thoughts in this area. So that's our kind of exam question, as Juliet said. What I've done here is I've underlined retrofitting, because as an architect, obviously we are concerned about designing all the time, but the elephant in the room is retrofitting. And I think that's what really matters now. I think the new build is easy to do, frankly. If you're not doing that right, there's a serious problem. But retrofitting is where the challenges lie, and that's what I'm going to focus here. I'm also going to pick up bits of the built environment that we don't talk about as well, which is not the outside bit, but the inside bit. You know, the indoor air quality, the overheating bit, which we will experience either today, tomorrow, or day after, as we work and live in our buildings. So just to give you some context, we know that places where we live, they have a significant impact on our mental and physical health. That came about in this NHS report. We also know that a lot of work has gone into healthy built environment communities and neighborhoods, either through availability of green spaces, looking at access to walking, cycling, public transport, use of appropriate building materials. There's been a lot of kind of discussion, a lot of research on this. But the area that we have paid less attention to is what happens inside. And that's become important because we used to spend pre-COVID 90% of our time inside buildings. I expect that's gone up to 95% now. So we are spending a lot of time inside our homes and buildings, and we know very little about what happens in terms of the indoor environmental conditions and the implications of that for our health. We are not measuring those indoor pollutants at all. You know, what happens is usually modeling of those pollutants. Very little work is done in terms of actual empirical measurement. BRE, Building Research Establishment, estimates old and inefficient housing is causing about 1.4 to 2 billion additional annual NHS costs. We know that we are going to have an exponential increase, hopefully, in home energy efficiency improvements to meet our net zero emissions targets. And that's also necessary to eliminate fuel poverty. And that kind of retrofitting transformation can change our indoor environment considerably, for the worse and for the better. depending upon how you look at the balance of indoor-outdoor air. Uh, this is challenging. Retrofitting is not easy and neither cheap. I'm not going to say this is kind of very easy to do, because our housing stock, for example, is different in terms of age, different in terms of construction materials, dwelling form, and most importantly, occupants and their personal activities that influence our indoor environment. And we need to kind of know the evidence for all that. Retrofit approaches tend to look at building fabric upgrades or services or controls that affects something what we call indoor-outdoor air exchange. And that happens because as we insulate our buildings, we increase the air tightness. So you're going to get less air from outside, so less polluted air from outside. But at the same time, the pollutants that are generated from indoor sources are also not removed, because you're going to have less ventilation, and that can cause health issues. Now, retrofitting should look at this. We should be looking at ventilation alongside insulation. In fact, there should be no insulation without ventilation. And we should also look at how you reduce emissions at point of use. And various research projects are now happening in that area. The other bit, which I couldn't help, of course, talking about is overheating, because you're going to experience it now if you're not doing it already. You'll be surprised to know that about 20% of homes are at risk of overheating today. In London itself, 80% homes overheated in the last 2 years in the summer. This is a real problem. And remember, having high temperatures is not good for health. It can lead to cardiovascular issues. It's not good for the elderly who are not sensitive to heat. And most importantly, awareness about health risks is very low in the UK, especially related to heat. And that's something that we need to really look at. A lot of research has been done in establishing the problem of overheating in temperate climates such as UK. Whether it's the extent of overheating, the severity of overheating, or duration of overheating, to different thresholds of temperature, whether it's 26 degrees or 28 degrees, in all kinds of buildings. We've looked at homes, care homes, offices, schools. I'm also looking at Ministry of Justice buildings. So, there's a lot of kind of vulnerable settings that are happening. Building regulation itself has recently changed to include overheating for new buildings. But what's really interesting is for existing dwellings, as the Committee on Climate Change said in their climate change risk assessment, there is very little incentive to retrofit adaptation measures to reduce overheating. And that's a serious concern, because we could retrofit the entire building stock to reduce energy use, but create another problem, which is overheating, and then start to look at maladaptations. So this needs to be looked at with a whole systems approach. And just to end, I want to kind of end with one of our projects that we very recently completed. This is a block of flats in Great Yarmouth. I'm an architect by training, so I like kind of getting the hands dirty and doing things. So that was how it was. It's a 1950s low-rise block of flats, and that is what it was after the retrofit. So we had near passive house standard kind of retrofit, very low U values, triple glazing, mechanical ventilation, heat recovery, space heating went down by about 80%. So all good. But my concern was what happened to the indoor environment. And if you just follow this graph, the pink bit is what happened before retrofit, and the green bit is what happened after. So I'm looking at CO2 levels, and you can see very clearly across the month, CO2 levels have gone substantially down, above 1500 ppm to, about 600-700. Relative humidity, which was fairly high, about 80-90%, which causes mold and condensation, has gone down again to 40-50% across different months. If we look at the temperature, temperature was very low before, but has now increased slightly and is more stable. And then VOCs, for example, you can see are much above the threshold, and VOCs get generated from personal activities of occupants, from using cleaning devices, from other activities in the home, have also come down, because what we did was we had good levels of insulation, but also had ventilation that was continuous and worked. And the sensors are kind of picking that up. I want to end by just saying one thing, that as we did the retrofit, one of the learning was that actually the VOCs level went very high when the retrofit was happening. And because most of the residents were staying in these flats while the retrofit was happening, they were exposed to very high levels of pollutants for the 3 months that the works were on. So we have to be careful as we embark on this national campaign of home energy improvements, that we are measuring the indoor air quality implications, which will have direct relationships with our health. I think I'm going to stop here. I might have used my 5 minutes already. Thank you.
That's great. Thanks very much, Rajat. Fascinating live project there on retrofitting. Now I'd like to invite Dr. Anna Andersen, please, to take the floor and give us your answer to the question. Thank you.
Thank you very much. So my name is Anna, and I'm one of two postdoctoral researchers on a project called Disobedient Buildings that's set here at the University of Oxford. It's funded by the Arts and Humanities Research Council and is led by Professor of Anthropology Inge Daniels. And in this project, we look at the everyday experience of people who live in blocks of flats that were built in the 60s, 70s, and up through the 80s. And what we do is that we compare 3 different countries and cities. So London in the UK, Oslo in Norway, and then Bucharest in Romania. And all of these buildings, they were built at what we consider to be the heyday then of the intersection between modernist ideals in architecture, but also the height of the welfare state. And we're interested now that we see there are some, in all of these countries, have been for the past 3 decades, neoliberal tendencies and reforms, and we wonder how that actually affects the people on the ground and their health and well-being. So in order to reach people in this project, which started in February 2020, so just in time for COVID, we designed research packs that we sent out to people who agreed to participate in the project. And this research pack has a lot of creative tasks within them, and there's a picture of the pack here. It has disposable cameras, drawing exercises, and questions that are quite open-ended in order to get maybe at the more unexpected aspects of everyday life. And we use these packs in 2 different ways. One of them is that we would bring people's answers back to them and then use them as conversation starters and kind of dig deeper into what matters to people. But then we also organize exhibitions in each of these cities and use the material from the pack in order to create a larger discussion with a larger audience. So what I brought with me today to address this topic of health, retrofitting and designing is 2 photographs that was submitted by a man called Hussein. Hussein, he lives with his family in a block in Oslo, social housing, and he has a background from Somalia, but lived in Norway for a long period of time. The upper photograph here, he took in response to the question, photograph something that makes a sound you dislike. And when talking to Hussein after, and also with other people who live in this block, it became clear that this is a block that actually has quite a few larger flats. It was built in 1979. And the fact that it has larger flats now means that it's housing then larger families. But the larger the family, the more the laundry, and especially during COVID as well, the washing machines, not just within your own flat, but from your neighbors, would then be quite audible and create quite a lot of noise and disturbance, which again then opened up a larger discussion about the role of sound in these blocks of flats. It was interesting as well how that led to Hussein talking more about the fact that he would like to be on the private property market. He could get a mortgage, but he decides not to. He doesn't want to take up a mortgage with interest because of religious reasons. So then he is stuck in this social housing block, but using his own words. So for him, also the fact that the Norwegian property market was deregulated in the 80s and the rise of the property values, then is definitely affecting his health and well-being. It also runs on electricity, and another thing that came up a lot in this research was the fact that electricity in blocks of flats built in the 70s, 60s definitely were not designed for the use of today. And also that there were then issues with the power, people losing power. In Norway, we don't have gas, for example, in the flats like we do here, so then you would lose your cooking possibilities, for example. And then that uncovered a lot of these infrastructures, formal and informal, for letting people know that you have an issue. And I think in all of the sites, Norway, Romania, and the UK, people who had issues very often felt they weren't heard. And that again affects the health and well-being of people. That being said, the other image here is answering the question, what do you see from your window? And what surprised, I think, all of us in the project was that a lot of these blocks, that living in them comes with the stigma, and people were very well aware of that. But people also had found a lot of qualities with these buildings. One of them were the view and the light that is possible because of the layout of the flat and also the size of the windows. So I think I'll just end there and say that it's been very interesting then to look at the everyday experience of people and getting into these conversations with participants, which I think has been very, very valuable, and that's led us at least to think about the role of maintenance in creating healthy cities and those like formal and informal infrastructures that goes into maintenance. Thank you.
Just quick introduction. Thank you very much, Anna. The Disobedient Buildings project, really fascinating and interesting perspective from humanities lens on thinking about designing buildings. So now we introduce Dr. Sydney Ayres-Mercer, who is tutor in architecture and urbanism at the Prince's Foundation. Thanks very much.
Thank you, Juliet, and to everyone at the GCHU. Now, when I was asked to address this question today around retrofitting and designing healthy built environments, I drew on my background as an architectural historian and thought of an example of my recent research, toilets. So whether you call them toilets, loos, lavatories, privies, it's a bit of a taboo topic that no one really wants to talk about. And I'm not necessarily advocating that it should be a polite topic of conversation, but they should be talked about more because there's it's an important issue that affects all of us here today and basically everyone on the planet. And toilets, crucially, the lack of access to toilets in public spaces has a direct consequence on health, and we can see many impacts on our health from the lack of access. So I just want to briefly start with a historic example, which is how I first came to this topic. This is a late 19th century cast iron toilet in Birmingham, and is one of many that used to adorn Britain's urban landscapes. And this one is, as you can see, affectionately named the Temple of Relief. In the 1880s, Birmingham's Public Works Committee constructed many such temples across the city in response to rising concern over public sanitation and cholera epidemics becoming almost commonplace. And from the late 19th century, public toilets were seized as a key solution to improve public sanitation across Britain. Town councils and local planning authorities erected similar such structures across England, Scotland, and Wales, usually in close proximity to railway stations, parks, churches, and other public spaces. Their location in or near to key public spaces encouraged widespread use through convenience and availability. And further, the grandeur and ornamentation served to elevate the nature of sanitary improvement by concealing its necessary and utilitarian function. I hope you'd agree that, such examples of public toilets are essentially retrofits. So, these are historic examples of retrofitting. But these concerns of public sanitation and health aren't just in the past. They are today's problems as well, as a lack of public toilet access has become a major societal concern. In 2014, the Great British Public Toilet website was launched, clearly showing a public anxiety around toilet access, as do many other apps and websites around the world. And this concern isn't completely unfounded. The British Toilet Association estimates that 50% of all public toilets have been closed or otherwise lost in the last 10 years, and those that do remain fail on cleanliness and hygiene standards. And recently, in 2021, the London Assembly Health Committee published a report on the provision of public toilets in London, highlighting the decline in provision and recommending that public toilets be made a statutory duty for local authorities. These issues have additionally been further exacerbated by the COVID-19 pandemic, as I think has come up already today. And in this case, the closure of spaces such as restaurants, cafes, museums, meant the closure of privately owned and maintained toilets that were publicly accessible. Now, why does this matter for our health? In short, as I kind of said before, the lack of access to toilets can have a huge impact on health. For example, if someone is going out and if they're unsure if they will find a toilet, they might restrict their fluid intake, leading to physical consequences such as dehydration, which can in time lead to kidney damage, hair thinning, and other serious health consequences. On the other hand, someone might hold on, which can have consequences such as UTIs, incontinence, and kidney disease. There are also serious mental health consequences, as a lack of access to toilets in public spaces can cause social anxiety, and in severe cases, people can experience social isolation as they may limit or completely restrict public outings where they aren't confident they can find toilet facilities. So clearly there's a public concern about toilet access and a health need for accessible toilet facilities. In short, toilets need to be open and widely available. But how do we do this? And crucially for our discussion today, is retrofitting the answer? Now these are some, in my opinion, bad examples of public toilets that have been retrofitted in public spaces across Europe. Some semi-permanent examples towards the left, and some more temporary solutions as you move towards the right. Largely placed out in the open, they are available and open to the public, but they can be problematic in many ways, including many of these will be inaccessible to a large amount of people, whether it's women, children, disabled persons, persons with mobility problems, amongst others. So even if a public toilet is technically available, it's not always accessible to everyone. And furthermore, it's a very different thing to have toilets that people can use versus ones they want to use. So I think you'll hopefully agree many of these are somewhat less than appealing. And this is why I believe a large part of the reason these kinds of retrofitting and temporary solutions often don't work. So then, as we move kind of to the conclusion, what kind of retrofitting works and what is the solution? To attempt to answer this question and provide a starting point for our larger discussion, I want to present what I think is a reliable, accessible, and clean public toilet, those at St Pancras Station in London. Personally, I've gone out of my way to use these or recommended that friends and family do if they're in the area, because you know they're clean and you don't know what else you might find. They cost £1.2 million and they were completed in 2013 and are still extremely pleasant to use, I think. However, this cost and timeline raises larger questions around the viability of similar schemes. Are locations publicly owned, privately owned? Who pays for them? Who maintains them? How long will they last? And will people want to use them? But nevertheless, we need to make toilets not only readily available and accessible in public spaces, but also appealing and clean, so that people will use them and have confidence in the provision of public toilets. Thank you.
Thanks very much, Sydney. A unique take on retrofitting, certainly. And now moving to our last speaker, Councillor Michael O'Connor. Would you like to speak from your seats? Yeah, certainly. Let me hand you this. Who is has got various hats. One is County Councillor for Oxfordshire County Council, also a student here at Oxford, and has been a GCHU and intern with us. So, Michael.
Yes, I'm here in a couple of capacities. I'll focus on the research that I did on ventilation, air quality and retrofitting, but I'll try to sort of draw out some sort of more policy-related upshots towards the end. So there's a strong link between homes and health. The association between cold homes and poor health has long been clear, but the cold isn't the only factor that's at work when it comes to health and homes. As was mentioned earlier, there's a growing awareness that indoor pollutants and mould can also have a substantial impact on health. So the sort of general point that I want to make is that when it comes to retrofitting, it's too easy to assume that better health goes hand in hand with reduced carbon emissions and also reduced cost. But in fact, those three things don't necessarily go together. And in fact, a growing body of research suggests, and in some cases shows, that retrofitting can and often does have negative health effects because of the way it impacts indoor air quality. So in this context, the key point is that many retrofits involve reducing air leakage. Often this has the unwanted side effect of reducing ventilation, which can concentrate organic pollutants like formaldehyde, induce mold growth, encourage dust mite growth, exacerbating respiratory conditions like asthma, and most perniciously concentrating radon gas. So although reduced leakage may sometimes reduce exposure to outdoor pollutants, modelling studies suggest without better ventilation, any positive effects in this direction may well be outweighed by negative effects on indoor air quality. For instance, there's a study in the British Medical Journal published in 2015 which suggested that assuming current building regulations, and I quote, and I won't go into the detail of the study, but unless specific remediation is used, reducing the ventilation of dwellings will improve energy efficiency at the expense of increased exposure to indoor air pollutants and risk to health. A separate paper produced by a team at the London School of Hygiene and Tropical Medicine noted, and again I'll quote, the monetised equivalent cost of the health disbenefits associated with increased exposure to indoor pollutants may often exceed the potential benefits of reducing energy costs and greenhouse gas emissions. Those studies were both modelling studies, so those were suggesting possible outcomes, but it certainly suggests that we should take seriously the possibility that without adequate ventilation, retrofitting could be actively counterproductive. And too often these interventions just aren't taken seriously enough. A review study in the journal Energy and Buildings in 2020 noted that, and again I quote, comfort and health tend to be disregarded, with both being seldom measured and only assessed by simulation. So actually kind of, how does that play out in practice when looking at specific retrofits or something kind of other than modelling studies? So first thing to say, there's lots of long-term observational evidence that energy efficiency improvements can reduce indoor air quality. So a study by a team at UCL using data on energy efficiency from 1980 to 2015 notes that, and again I quote, energy efficiency measures that increase the air tightness of properties are observed to have an adverse association with indoor radon levels. And double glazed windows were observed to have the largest association with indoor radon levels. And radon, I should add, is the second leading cause of lung cancer worldwide. And the review that I cited earlier considered a few studies which showed that retrofits sort of drawn, looking at more the kind of the past 10 years, can negatively affect indoor air quality. And I'll cite just one, it's kind of on the micro scale in specific relation to like a particular set of retrofits. A study that examined the effects of retrofitting 15 houses near Dublin, published in 2017, suggests that there was a significant change in the concentrations of a number of pollutants, which may be attributable to reduced ventilation rates as a result of improved building air tightness. They particularly emphasize the increase in formaldehydes. And it's sort of framed in quite a cautious way, but there's a sort of series of studies. It's very much a developing area of research, emphasizing that there can be these negative health effects. Often the impact of actual retrofits is dependent on specific factors like the quality of existing ventilation, household behavior, things like whether people open windows, whether they smoke, and also the toxicity of, and this was mentioned earlier again, of indoor pollutants is very poorly understood. So for instance, the modelling studies are quite dependent on how toxic these things actually are. But the broad conclusion is quite clear, which is that retrofitting could have and may often have negative health effects. In terms of what we can do about this, I don't have the expertise to make specific comments on how we can measure these things or building regulations, but here's a couple of upshots for kind of local and more general policy. So a lot of public policy is based around improving energy efficiency ratings, EPCs. But now a focus on just improving energy efficiency ratings is problematic because they don't take account of health-related factors like indoor air quality. These things are rarely measured, they're not taken into account. So a good start would be simply either integrating them into energy efficiency measures when it comes to thinking about retrofitting, and just measuring these things in the first place, which was again mentioned earlier. And a second thought is that really what's needed is that a kind of public health perspective needs to be embedded from the off. And one way, and this is thinking more with a councillor hat on, is to involve local authorities and give local authorities the lead, because public health is still based at the local level. So rather than, for instance, central government-led retrofitting schemes that entirely bypass of local authorities, or funding schemes that local authorities have to apply for, and a sort of endless hamster wheel of grants, it would make more sense to have, for instance, ring-fenced, well-funded local teams working on retrofitting in collaboration with public health, or otherwise create those kind of linkages. So the general point is that we need to be very careful to ensure that health effects are rolled in when thinking about retrofitting, because otherwise we'll be building homes that are better along one dimension, but worse along another. Thank you.
That's great, thanks very much, and interesting to have that policy perspective at the end. I'd like to open it up to the floor now, so if anyone has any questions for any of the speakers, or a question that you'd like all the speakers to address, one in turn, do go ahead. Yeah, so a question at the back, David.
Yes, this is not Councillor O'Connor might have a view, but it's for everyone. Where do politics fit into retrofitting? I mean, is there a political agenda there to actually make it work? Because we have lots of solutions, but they're not being implemented in a broad way. So I think, do politics have as important role to play as, say, technology or just know-how?
Who'd like to take that first? Yeah.
I'll definitely say yes. I think one of the things we've seen in the Disobedient Buildings project, which looks back in time, is how striking it is to see the policies made then in the 80s or even in the 60s that they're still felt and experienced today. And when it comes to these issues of retrofitting and making these changes or making it work, I think it most definitely is a political issue that you would not only see then the year after that policy is made, but probably in 60, 100 years' time. Yes.
I think there are positives and negatives here. Definitely today we have a reduced energy demand in homes because of home energy efficiency. We don't have the same demand as we had in 1990, and that's primarily due to insulation measures. But I think some years back, some of those policies got abandoned. Some of you might remember the Green Deal, how it came and went. So it's also led to bad kind of press about home energy efficiency. And I think we have to be careful that as the industry calls for a national retrofit strategy, so there are bodies now which have a fully developed national retrofit strategy. I think the politics of that has to make retrofitting a national infrastructure policy. And I think then it will start to bring together not just energy efficiency, but indoor air quality, health, overheating, everything together in one kind of remit, so that one improvement doesn't lead to other unintended consequences. So I think the opportunity is definitely there.
Yes, I mean, I think it's definitely, it's absolutely saturated with politics. I mean, one important thing is just the kind of urgency of the broader issue that retrofitting is part of, i.e. reducing carbon emissions. And that, I mean, that has implications because so many of the approaches are a very big part, but really you need a coordinated approach. But that doesn't necessarily mean a kind of a centralized approach. It means a kind of joined up approach that also takes account of local. You look at something like, for instance, the track and trace system during the pandemic, and many of the most successful attempts were made on the local level. And I think it would be similar with retrofitting. It should be empowering a sort of decentralized system. But just in terms of like specifics, for instance, the government had, I think it was something like the Social Housing Decarbonisation Fund last year, and this made available something like £1 billion to local councils. But they were very, the plan was drawn up at speed. The deadlines were incredibly tight. The trouble with a lot of this is councils have to apply for funding. They're on a constant hamster wheel of applying for funding. Then they don't have the staff to deliver it by the deadlines, and they're punished for not meeting it by the deadlines. So one of the outcomes of this particular scheme, which was drawn up in the space of 12 weeks by the relevant government department, was that half of all councils didn't retrofit a single home before the deadline. These were often ones where they made the commitment to retrofit 400, 500 homes, and they couldn't retrofit a single one before the deadline. And there's so many reasons to do this, which is partly the deadlines were entirely unreasonable, partly the schemes were badly designed, and partly that the schemes didn't come with, for instance, funding for additional staff. So it just kind of had to come out of those kind of costs. So there's an example of somewhere, of like a kind of specific problem with a way of trying to combat retrofitting. And this is also connected with what I said earlier, because the scheme was directed at improving EPCs to C or above or something. But of course, if that's your goal, and that doesn't take into account, for instance, health effects, and it's trying to deliver it to very tight deadlines, then in trying to deliver to very tight deadlines, given this kind of objective, you may well end up with retrofits that result in worse health, even if they reduce energy costs.
Yes, I guess I'll just comment to kind of reiterate a lot of what's already been said. I think politics is a component of most things, but in my experience, it's also tied to money and funding. So I think what Michael said about local councils having responsibility, but then not having the staff or the capacity to deliver these things is very true. And in many cases, they're already called upon, stretched thin. So in my less glamorous example, many public toilets are closed because the council doesn't have funding or the staff provision to look after them, and there's no legal obligation to have them. So they get closed. So whether politics needs to be on board, whether money needs to be in place, there's a lot of things that need to come together.
Any other questions? Yeah.
I've got a question about toilets, actually. I'm curious about your research and whether there's a sort of international dimension to it. Because my understanding is, I've not been abroad for a while, that if you go to France or Spain or whatever, that people have the right to use toilets in cafes and restaurants and so on, without having to buy anything. It's very different in this country. So there might be a simple fix, which is to do with legislation or policy. So I don't know if you've done a comparison with the effect of access to toilets abroad with the lack of access to toilets in this country?
I haven't, no, but one interesting thing in that 2021 London Health Assembly report, one of the recommendations they made was to speak to private developers, cafes, restaurant owners, and talk to them about advertising that they have toilets and actually making them publicly available without purchase. That's essentially a huge untapped resource that, you know, could increase provision. So I think that the thoughts are there, but whether the public and private interests can come together.
Any other questions? Yeah, Brookes.
This goes to Professor Gupta's example of that incredible retrofit that you did, and some of the data that you showed us, which is specifically looking at pollutants and energy efficiencies and those sort of aspects. I was interested in whether there was any interest in measuring the health. If we were talking about the health impacts of those different measures, but whether there was capacity or interest to actually talk to those occupants to see if you could measure health outcomes in those sort of examples, and whether there's a financial interest or a research interest or a way that health, as Michael was saying, could become sort of standard when showing the benefits of retrofitting.
Thanks for the question. It's a very good point. We did investigate the health effects through self-reported questionnaires, also visits to GPs. We also measured smoking kind of habits, because previously some of the residents were smoking inside, and then they realized that now the indoor-outdoor exchange had actually reduced. Smoking inside wasn't the best idea to do. And also we were measuring PM2.5 and PM10, so we could figure out very easily if somebody was smoking inside. So I think it had those kind of side benefits. We did find that in one flat particularly, asthma reduced quite a bit in the residents. They did have less use of inhalers, they reported, and less visits to the GP. But I think this needs to be investigated more holistically. I would have liked to measure people's core body temperatures in the summer to really see what happens when they are in these flats which are pretty airtight. Are their core body temperatures changing? Not the room temperatures that we measure, but our own body temperatures. But there are challenges in doing that, obviously, because you have ingestible pills and other things that you have to, which is probably beyond my architectural kind of capacities. But no, I would love to work with health practitioners and push this forward, because in the project there were a lot of benefits, but they were not easy to get. This is not easy. I'm not saying retrofitting was easy. It had a lot of issues because occupants were inside the homes. And one of the bits that does not get measured is what happens during retrofit when we are doing, let's say, decoration or other paintings going on. There is a lot of increase in VOCs, formaldehydes, that time, and they were exposed to significantly high levels, even if it was for 3 months, but they were getting exposed to it. And that's the time when no measurement is usually done in projects. It's either before or after. And I think we need to kind of have a very longitudinal approach to this to build up that empirical base, I think.
Any other questions? Yeah.
I have this question for Professor Rajat, that we know that overheating can be mitigated by purge ventilation or by using MVHR, mechanical ventilation. So is there any resistance to use of mechanical ventilation in retrofitting homes or by people in general in UK, that they don't want to enter into that extra added budget of MVHR or?
It's a good question again. See, MVHR, what we have to understand is 99% of UK housing stock is naturally ventilated. If I have a show of hands here, how many people live in homes with mechanical ventilation and heat recovery? I doubt I'm going to get more than 2 or 3 hands up. So it's not something that we are used to. Many people who live in homes with MVHR perceive that they cannot open windows, which is wrong. It's a myth. You can have MVHR with a summer bypass. So you don't actually capture the outgoing heat in that summer bypass. You're actually getting air from outside. But those bits are not kind of communicated to residents. Whether you need MVHR in every retrofit, I don't think. I think that we need a national debate in UK to look at the balance between air tightness and ventilation. Because if you're not going down to one air change, you don't need mechanical ventilation. There are very good passively kind of ventilated, energy efficient buildings, but they're not one air changes. They are 3 air changes or 2 air changes and work fine. So I think there is that debate that needs to be had. In terms of cost, I think it's important to remember if you put an MVHR in someone's house, it costs about £6,000 to £8,000. And from the research that we've done, we've observed that it adds up to £300 to £400 a year in terms of its running costs and changing filters. So it is an expense. This is before energy prices went up. The other bit we found was that if fuel bills go high, occupants tend to switch off the MVHR system because they think it's always on, so it must be using a lot of electricity. And that causes a lot of problems because you have inadequate ventilation, so it leads to condensation, mold, indoor air quality problems. So it needs to be solved in a holistic manner. There are benefits, but you can have disbenefits if not done properly.
Thanks. Any other questions in the room? I have a question, if I may, just to Anna about the Disobedient Buildings project. And I was just interested from the perspective of the residents in the buildings, how far they felt they had agency to address these disobedient buildings, and how far, on the other hand, it was perhaps sort of systemic and more structural. The problems were perceived as insurmountable. So a question about empowerment of the residents.
I think the different blocks, I looked at I looked at 7 blocks in Oslo, both privately owned and social housing. In London, we looked at even more, also different ownership models, and the same in Bucharest. And what we found is that there is a big difference whether or not people own their home, to how they do feel that they have an agency. But it's also quite important the human contact people might have with a landlord or a council, and whether or not you meet an automated phone system or a person, and also how that has changed. More and more, I think now people are describing that it is very, very difficult to kind of reach a person. So it's a wide variety actually, and you could definitely see that the people who do feel that even if it takes a while for things to get fixed or to improve, if you know how long it will take, it's a lot less frustrating. I think one exception which I've looked at a lot is the issue related to sound. Because you can't control sound in the same way as you perhaps could with, if there's a leak, you could fix the leak. Either you fix it or you don't fix it, and it takes a certain time and someone needs to pay for it, whereas sound can come from a neighbor far away, it could come from kids playing, it can, and that issues with sound, I think it's where I at least experience that people feel they have the least agency and the least control, and again, very much heightened during COVID. Thanks.
Other questions? Yeah.
Yeah, just so I mentioned politics. I'm wondering, are the speakers optimistic about retrofitting, given facing inflation, economic issues globally? I mean, is it something that requires money as well as the political will or individual will? Do you mention the cost of
the heating, and there's similar figures about putting solar panels in, and actually when do you actually start breaking even, let alone sort of gaining from it. So I wonder, is economics a key factor, and are you optimistic that retrofitting UK or retrofitting globally, wherever needed, will go ahead?
I can try answering it, and I'll hand it to you, Michael, then probably. Yes, definitely. The reason is rising fuel prices. If you redo the calculations of payback period for different retrofitting measures, they will look very different now. Also, there are other innovations possible in business models for doing retrofits. Retrofits need not be done in the ways we've been doing, which usually is over time. So you do single measure, and then do another after 2 years, another after a few months, or do whole house, or they're community-led retrofits. But there are other models now. We've seen Energy Strong kind of a model, which is more industrialized. There can be others as well, which may work. There are also possibilities of having different revenue streams through demand-side response and demand management. So if someone's putting a heat pump, if they're able to shift the demand for heating to periods of outside of the peak, they might be able to earn additional revenue locally and from nationally. So I think possibilities are endless now, and given the rising prices of energy, I think there is public attention. I think what is lacking at the moment is a national retrofit strategy endorsed by the government and kind of managed centrally and delivered locally.
I think I would basically echo in terms of optimism or otherwise, not necessarily much optimism, but there's not much optimism in most fronts when it comes to carbon emissions and that kind of thing. But I don't necessarily know if that's much of a general answer. But certainly the need for a kind of national strategy is clear. For instance, the Mayor of London sort of released a London-wide strategy last year, which attempted to do some of these things about drawing together public health and making it appeals to not just social housing but also private landlords and homeowners, and looking at how retrofitting measures need to differ depending on the kinds of houses that it impacts. But there's only so much that you can do when you have that kind of limited power. I think it does kind of come back to that, which is that to have a national retrofit strategy, you have to have a government that wants to have one and wants to implement it, which we don't. So, it's okay.
Yeah, the question at the back there.
Thank you, excellent. Really enjoyed all the presentations. This question is for Anna. You mentioned a lot about sound, and the question was about buildings and helping our health. And I was wondering if there was any research that you were a part of that also kind of assessed the health impact itself of the sound. You mentioned anecdotally and kind of in the different ways that you were kind of trying to gather information. But I wondered whether there was any research being done on kind of sleep quality or mental health or anything like that that might be impacted by high levels of sound pollution, if you will, or something like that. Thank you.
Yeah, that's a great question. There's definitely lots of literature looking at the impact of sound. For example, a book on sonic warfare, for example, and how incredibly disturbing it could be to be in a sonically unpleasant environment. I'm thinking, one of the things when it comes to sound is that there's the tension that sound can create within, for example, a block of flats could really affect relationships between people. And again, like the case studies in Oslo, people do communicate on Facebook groups, for example. And difficulties sometimes of determining where the sound is coming from creates a lot of tensions and frustrations, and I think also the later at night there is disturbance. I think, you know, the maybe more eager people are to write on these social media platforms. So there would be an interesting thing to perhaps look more into, because I look more at, you know, those tensions and trying to distinguish them and who are the tension between. And quite often as well, it's not necessarily between the person who's experiencing it and the person who made the sound. It's between two people within the same block experiencing it and then starting to argue about what should be done. But what are then the impact on people's health from that would be very interesting. Yeah.
Can I think it's a really interesting question. There was some research done linking, I'm going to say noise now, from ventilation systems to sleep quality. And there has been some work published, I think, which is saying that people tend to switch off those systems if they cannot sleep. So I think that there is a link. The other thing that's come about is when you look at ultra efficient homes, there was some research done which said that people who live in homes which are very airtight tend to have less tolerance about noise levels or sound levels, because they are in such a quiet home with triple glazed windows that, and I have been doing some interviews with people where I actually didn't feel there was any noise, and they were getting very sensitive, you know, to a little bit of noise as well, because they were used to being a very quiet home. So I think there are both sides of it, and sound is a good area actually to kind of get into. Okay.
That's great. Well, thanks very much for that. And I'd just like to, just wrap it up with a big thanks for our 4 speakers for joining us today. Thank you to you. Oh.